Often people describe narrowing or changing the shape of the nose bones as re-breaking the nose. In fact, what we do, we use a technique called an osteotomy. And an osteotomy is a cut in the bone. What cutting the bone does is it destabilizes it and allows me to mobilize it. That way I can actually push the bones and narrow them in a very controlled fashion. An osteotomy is just a bone cut. And you can use that term when we remove the nasal hump. If we're removing a bony hump, we use an osteotome and perform an osteotomy. It's just a bone cut. And you know, in the old days, people used to describe that as breaking the nose. And I think that's a little bit of a misnomer. Yes, the chances are that you'll have a small amount of bruising around the eyes. It's not painful. It's just a little bit of blood that comes from the edge of the bone cuts that seeps in underneath the very thin eyelid skin. Because the eyelid skin is so thin, you can actually see a little bit of that bruising. Otherwise, you wouldn't. The recovery period from hump reduction and osteotomies to narrow the nose is not generally painful. The nose is not a weight-bearing structure. When you walk, when you sit up, you're not using the nose to support your body in any way, so it can be rested easily just by not putting glasses on it or not touching it, so it's not generally painful. The most important thing is that you have to maintain the cast that I apply for the week after the surgery. So there's a cast that's put on right after the hump reduction is performed, and that compresses the skin and the nose bones to keep them aligned. So basically just keep that on, make sure you don't take it off or wash it off, and that's all you really need to do.